Would like to launch the EULAR Precision paper on access to healthcare, and the paper will be available to all of you. Probably, I hope you have already received it, but it's in your document. And we think this is a particularly important paper because it addresses a subject we already mentioned several times, the access to healthcare also for people with rheumatic diseases in Europe, and this is focused on this item and was actually generated based on last year's conference in the European Parliament, which was also of particular interest to us. So let's briefly reiterate the burden of RMDs and the need for action, because sometimes in the public opinion, rheumatic diseases are not very important. They think about stroke, myocardial infarction, infectious diseases, cancer, of course, but what does RMD really mean? And but we all know that they represent chronic diseases with enormous burden. We have more than 120 million people in Europe alone being affected with rheumatic and musculoskeletal diseases. And as Marius already mentioned, it is the #1 cause of disability in Europe. And that needs to be stressed all the time. And sometimes this is sort of neglected by many people. And also the yearly economic burden of more than 240 billion euros on public budgets in Europe is really very, very strong and therefore needs to be addressed as well. So what are the relevance of access barriers? They are still a key concern for people with RMDs. We already discussed it this morning in the welcome introduction, and other chronic diseases despite principle of equal access throughout the member states. And as we also mentioned, the pressure of the financial crisis has negatively affected the provision of healthcare services in some countries further. And whenever I ask my students what is the most successful discipline in medicine, I guess you can already know the answer. It is rheumatology. So we are really very successful. And of course, sometimes we argue with the cardiologist, the oncologist, but I think we are right. I think who disagrees? I don't see a hand. So very easy. So it is very important so that we realize that we all together sitting here have made a great contribution to the advancement of medicine, and with great diagnostic tools and therapeutic tools, as we already mentioned. So this needs to be accessed by the patients affected. And the burden of the chronic disease will significantly increase as a result of aging populations and unhealthy lifestyles. So this is also something we have to recognize, that we will have more and more patients with this. So bringing down barriers to healthcare is a necessity and not just an option. So we need to work on that. It is an investment also from an economical standpoint that will ease the burden of rheumatic and musculoskeletal diseases, and of course as a role model also for other chronic diseases. So as I mentioned, we had this beautiful 2014 EULAR conference in the House of Parliament, which I found extremely impressive, I must say, and that analyzed how to reduce the access barriers to healthcare for people with chronic diseases in Europe. And based on these results, we developed a position paper. We again are very thankful to Takis Hadjigeorgiou for hosting that in the European Parliament. It was also organized in collaboration with the key stakeholders, and we had input from EU and national policymakers, organizations representing patients, health professionals, scientists, and researchers, also as well as healthcare organizations and other key stakeholders. And we also received a detailed feedback from 24 EULAR member organizations, such as scientific societies, patient organizations, and health professionals in the process of drafting. So which main access barriers had been identified? So health systems coverage and management was already discussed this morning. Performance and organization of the healthcare services, relationship of patients with health professionals, health systems and treatments, and finally also very important, availability and affordability of medicines and treatments. I mean, what does it mean? We have excellent treatments available, but if we cannot provide our the people with rheumatic and musculoskeletal diseases with these treatments, they're not very helpful. So we need to make them available and affordable as well. So what are the policy recommendations? So we would call for policymakers at all levels to take action on each of the barriers. We particularly appeal to the EU institutions, the member states and regions, but also to the stakeholders. So what are the next steps? We would like to disseminate this to policymakers at all levels, participate in public consultations by the European Commission, and finally discuss with policymakers and stakeholders at the EU and national levels on how to implement the policy recommendations included in the position paper. So thank you very much for your attention, and actually the paper is now available as of today. You can just download it from the EULAR website, eular.org, Public Affairs Position Paper, and then you can distribute it, and it will also be published in a rheumatology journal. So with these words, I thank you very much for your attention.